Hello, this is Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about what goes on during neuroma surgery. Now, for those of you who don't know, a neuroma is a very common foot condition which basically involves inflammation and irritation to one of the sensory nerves in the foot. Specifically, these are the nerves that travel in between the long bones of the foot and supply two adjacent toes with sensation. This nerve primarily just has a sensory role and doesn't really have much of a role in how muscles operate. And so the abnormality with the nerve is primarily going to be one of abnormal sensation, which typically is pain. The most common location for this condition is going to be the nerve that involves sensation to the third and the fourth toe of the foot, although the nerve next to it on either side can also become involved as well. What happens during the formation of neuroma is that for one reason or another, which I won't get into because it's a fairly complicated explanation of foot structure, the actual nerve tissue itself becomes irritated, or rather the tissue that surrounds the nerve. And as that tissue becomes more irritated, it becomes thickened and forms almost like a hard fiber shell around the actual nerve itself at one specific spot. It almost looks like sort of an onion bulb if you were to kind of look at it when you actually see the neuroma itself, with the normal nerve being sort of like a strand of spaghetti, and then the actual neuroma portion sort of a thickened, almost small onion bulb-like formation around that strand of spaghetti. Neuromas can have a lot of different symptoms, but the most common one is going to basically be the feeling of pain, almost like you're stepping on a marble or even a hot pebble underneath the ball of the foot. And you can also have symptoms associated with that neuroma on the toes that it supplies sensation to, specifically tingling or even numbness. Now, treatment of a neuroma usually involves injection of a steroid compound to try to reduce the actual swelling around the nerve, as well as other things to reduce the mechanical irritation on the nerve, including the use of orthotic inserts to reduce pressure to the ball of the foot, and general anti-inflammatory medications as well as icing. When those measures fail, you basically have to resort to surgery in order to remove the underlying problem. Now, it's actually quite easy to treat a neuroma surgically. Since it's just mainly a sensory nerve, getting rid of the nerve in question doesn't really have any abnormal effects on the body, with the exception of a small patch of numbness that really is only felt if you were to stroke the skin. It's not like you wake up and you have no more sensation to that one particular area. You really have to stroke your finger along the skin to kind of notice that numbing effect. What generally happens to treat a neuroma surgically is that an incision is made across the top of the foot over the ball of the foot, essentially kind of at the bases of the toes. Now, the neuroma actually sits on the bottom of the foot. There are two sets of nerves, one on the top, one on the bottom in these spaces, but it's the one on the bottom that's primarily involved the majority of the time. But it's easier to go through the top to get to the bottom, because an incision directly on the bottom can often lead to a more painful scar once that heals. So the incision is made on the top of the foot at the base of the toe, and then the metatarsal bones, which are the long bones, as I said, in the foot, have to be separated just a little bit in order to be able to see the nerve on the bottom. And there's also a ligament that sort of binds the two joint heads of those bones together, the bones that are next to each other. And so that ligament has to be released. And as that ligament is released, a lot of pressure is released to decrease irritation to that nerve. Now, some surgeons advocate that just simply reducing this pressure is enough to basically solve the problem of the neuroma. I prefer just simply to get rid of it altogether, because I said it's really just sort of a sensory nerve. It doesn't have a hugely vital role, and once you get rid of it, you are guaranteed not to have any more pain with that, because the nerve simply isn't there. Basically, the nerve is sort of Y-shaped at this area once you go down and identify it. The base of that Y is going to be where the nerve is coming from within the middle of the foot, and then sort of the two arms that branch outward of that Y are going to go to one of two different toes that the nerves branch to. And what you have to do is you have to be careful about removing as much of that nerve as you can see in order to get rid of the problem. And the neuroma doesn't encompass that whole area, but if you leave sort of a loose strand of that nerve sort of sitting in an open space, what can happen is that the small fibers of the nerve that try to eventually heal itself and find the other end of where it was cut will eventually fail because there's going to be too great a space between where the nerve was cut on either end of the nerve cut, and that little fibers that are trying to repair itself will form a little ball which can become just as sensitive as the original neuroma. We call this a stump neuroma. So when the nerve is identified and then basically cut out of the body, it's done so far enough back into the middle of the foot as well as up towards where the nerve fibers branch into the toes, so that those cut fibers will sort of slip back into deeper tissue, so that the little nerve fibers that are trying to repair themselves at the cut end of the nerve have nowhere to go, and so the stump neuroma doesn't form. Basically, the space created by this incision, at least internally, where that ligament was released, is left open, although you can tighten it down just a little bit to try to avoid any fluid from forming within the space that was created by the removal of the nerve. And then basically the skin on the top is closed, and some stitches are put in place, and that generally that site heals within about 2 to 3 weeks for most people. The incision will heal faster than that, but the underlying tissue that was sort of disrupted by the surgical process itself will usually heal within about 3 weeks, and most people can get back into a relatively decent regular shoe at that stage, although some people are still a little bit tender maybe a month after the surgery, but that's not usually very common. By removing the nerve, the entirety of the problem is solved, and as long as there's no development of a stump neuroma, there really shouldn't be any reason for any further pain at this location due to this condition. Well, I hope you enjoyed watching this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.